I want to welcome everybody to today's webinar, HIPAA Compliance, 7 Most Important Practices. I want to thank you for attending. This is really important content. We continue to learn new information. And today, Janet Reed, my friend and colleague, will share some of the recent information that we've learned and some feedback from recent audits. So helpful and important information. We're going to move quickly. So I'm going to just introduce the agenda, the key elements which we see most frequently failing in a compliance audit, keys to surviving an audit, differences between breach and incident reporting, keys to policies and procedures, risk assessment, crucial elements, the importance of documenting, not only providing staff training, but also documenting that. And then what is the technology's role in monitoring for compliance when it comes to risk assessments and audits. So I want to thank the many of you who are long-term PBSI clients. Thank you. We've known many of you for years and years, and some more recently. And then I want to thank also those of you who this is your first exposure to PBSI. Our goal in all of the webinars we do, including today, is to inform and educate. Sure, we have products and services to sell, but we want to pass on from the information we've gained to help protect and assist clients. So those of you who are listening, you come from different places. Some of you are very experienced in either technology or security, and you're just brushing up on knowledge. I congratulate you. Some of you know that you're under-secured or don't have the knowledge that you might want to have about your security when it comes to an audit. So for all of you, you pretty much know already the internet is a very dangerous place. Keylogging and phishing attacks are continuing to grow. It's hard to keep track of all of the new events. You may have seen that just this past week, health.gov, the website for Obamacare sign up, was hacked. Might make all of us think, why bother? The government can't keep their site secure. Still, they require security, and we need to understand it. And we have legitimately, forget about the government, we have an important obligation to protect patient information and to protect the health of our practice. Nobody wants to give back money that was received 4 years ago for a meaningful use attestation that now is questioned and eliminated, plus penalties because of an audit. So the keys, we're going to talk about primarily the security risk assessment and compliance issues today, the basic blocking and tackling of security, which we cover in a lot of webinars, having a good firewall in place, making sure antivirus, patch updates, vulnerability scans, and monitoring are in place. We'll briefly touch on that today. And then we'll also look at an option for employee education, which is not new, but we have become proficient in offering this, and I think it's something that could be of real interest for those of you who believe, like many clients we see, where your education process has been spotty or incomplete. So it's important that we protect information. I'm going to turn over the microphone and screen now to my friend and colleague, Janet Reed, who's had years and years of experience working with dozens and dozens of clients on site and in other ways helping clients with security. So Janet, welcome. I'm going to turn this over to you.
Great. Good morning. Thanks, Ray. Can you see my screen?
Yes.
Great. Okay. Thank you so much for attending. A little bit of background on myself. I've spent 21 years with PBSI. About 50% of my time is spent training out in the medical offices. And PBSI has been helping clients with meaningful use preparation, attestations, and audits since back in 2011. So I appreciate your time and want to share my experience with you and give you some tools and tips in hopes it'll help you to become HIPAA compliant. So today I'm going to be discussing the important practices to audit-ready HIPAA compliance. And we're going to be reviewing the keys to surviving an audit, the what, when, and how of breach reporting, policies and procedure must-haves, and the importance of the security risk assessment. So we're going to address two types of audits: a meaningful use audit from Medicare or Medicaid, and a HIPAA investigation from the Office of Civil Rights resulting from a breach or a complaint. So to start out, we're going to look at an audit for a HIPAA investigation. So what I've done is I've listed what needs to be in place and active when the complaint or the breach occurred. So you have to have policies and procedures. They have to be written to match the procedures that are happening in your office. You have to have a formal security risk assessment, a signed sanction policy for each employee, an assignment of a security officer and security team. A review of your information system has to include audit logs and proof of review of activities. For instance, a required event logs of failed password attempts, your patch management activity, a current antivirus installed. And then there's workforce security. You have to set up users with unique user accounts, and they need to have access to only the information that they need to do their job. You need business associate agreements in place for any vendor who has access or potential access to your data. And also, it's a good idea to keep a log of all of these vendors. I've read from HHS that that's what they're going to be asking for, is just a log of each one of the vendors, and it's a good thing to do. You need to have an active training program, including training logs and proof of sending periodic security reminders. Policies to include, but not limited to, a login and password policy, a physical access policy, and security incident reporting policy, and a disaster recovery plan. So a meaningful use audit, it can differ slightly depending on if you filed your attestation with Medicaid or Medicare, but you are pretty much guaranteed that you will get an audit if you've participated in these programs. The auditing can take place up until 6 years after your attestation. And when you receive the letter from the auditor, you'll have approximately 2 weeks to comply. And you're going to need to send in proof of using a certified EHR. And this could be as simple as a letter from your EHR vendor with their certification number on it. You need the EHR report that shows the numerators, denominators for percentage-based measures, and the time period that the report covers, and the specified provider name need to be on the report. Validation of the clinical quality measures, and these could be some screenshots that you took back when you did your attestation. They'll ask for those to be dated. All the measures that you answered with yes or no without percentages will need to have screenshots to show proof the measure was in your EHR. And an example of that could be like drug-to-drug and allergy interaction checks. You need your security risk assessment, and that's going to be the #1 request on your letter from the auditors. Documentation of any exclusions that you'd taken. An example would be like for immunizations if they weren't part of your practice, or maybe your health department didn't accept electronic submissions. So with permission from our client, I'd like to share with you an experience of a recent Medicaid meaningful use audit conducted at the client site. So even though HIPAA said audits in 2017 would be desk audits, this audit was done on site. The client received an email in late November requesting an audit of meaningful use attestation for 2014. They had a list of pre-screening questions, and also they requested a report of all patients seen in 2014 and their insurance package. These documents were requested to be uploaded on a secure portal for Medicaid. So we prepared in advance with supplying the client with the needed report. Then we prepped the staff by reviewing policies with staff, reminding them of the security safety, making sure all the employees had their badges on, knew that the auditor was coming. And we had policies and procedures and the security risk assessment ready to go. The auditor went through every attestation question on the meaningful use attestation and required print screens for measures that did not involve patients. For patient visit measures, they required a list of each patient visit and whether or not they met the measure. The auditor also reviewed the procedure and policy manual, training logs, and security risk assessments, and asked for a copy of the risk assessment findings page out of the security risk assessment. So the auditor was there about 2 hours. We had some follow-up with her for the next few days to get all the reports that she requested, and this client did pass their audit. So you must prepare in advance for a successful audit. You don't have much time to get the information in when you receive your letter or your email. So start your documenting. Get that security risk assessment, because without it, it's an automatic fail of meaningful use and MIPS, and they'll take the money back. You need an assignment of a privacy officer with their job description, a security incident logs and security incident report documentation, HIPAA training logs, a HIPAA sanction policy signed by each employee, employee responsibilities signed by each employee, policy and procedure manuals including all aspects of the HIPAA privacy and security rule. So your security risk assessment, it's your guide to all the needed policies, and the auditors will talk to your staff. So I'm going to spend a few minutes talking about breach notification requirements. So what is a breach? How do you know if you had a breach? So not every disclosure of PHI is a breach. Your organization must determine if you've had an incident, a violation of the privacy rule that doesn't constitute a reportable breach, or a legitimate breach. So they call that an incidental disclosure. And it's described as when a patient information is disclosed to persons not involved in the patient care or disclosed to other patients. So some examples of just an incidental disclosure would be your sign-in sheets, maybe calling a patient's name in the waiting room. Sometimes examinations rooms are not soundproof and you can hear through the walls. Maybe a patient comes out of a room and then starts asking about their care in a public area and someone else can hear them. A telephone call that can be heard might be overheard. So those would all be considered a incidental disclosure, and they don't need to be reported. Some examples of a breach are a stolen computer or laptop, unless it is encrypted and you can prove that no PHI is present. Records stolen from a storage facility, ransomware, lost or stolen charts, records sent to the wrong patient, or records sent without patient authorization. And this list just goes on and on and on. So who do you tell about a breach? It's important to know if you've had a breach to correctly analyze it, because you're going to need to know the nature and the scope to communicate to the correct parties. So covered entities have 3 parties that they need to notify of a breach. They need to notify the patients involved, the Department of Health and Human Services breach portal, and potentially the media. So if you have a breach, you always need to notify affected patients and the Department of Health and Human Services, no exceptions. If over 500 individuals have been affected, then you must alert the media. So what do you tell them? In order to properly comply with the breach notification rule, there are several aspects the breach organization needs to communicate to the affected parties. You need to tell them what happened, what kind of PHI was disclosed, what you're doing to investigate and mitigate future harm, and how patients can contact you. And then how long do you have to report a breach? A breach of 500 or more individuals must receive notifications without unreasonable delay and reported no later than 60 days following the discovery of a breach. Notifications of smaller breaches affecting fewer than 500 individuals may be submitted to the Department of Health and Human Services on an annual basis. But you might also have a state law that's different than the HIPAA regulation. So in Ohio, any business that experiences a harmful data breach must notify affected Ohio residents within 45 days by mail, telephone, or email. So check your state agency for additional laws. Right now, Indiana and Kentucky do not have a specified number of days, so that means that you have to follow the HIPAA regulations of 60 days. And for media notice, you must make every effort possible to contact the individuals affected by the breach. So the breach affecting more than 500 residents of a state or jurisdiction are required to provide notice to a prominent media outlet serving the state. And this is in addition to notifying the affected individuals. And so what do you do to reduce your risk? So I don't think you'll be surprised by the answer, but you establish policies and procedures and you train your employees regarding breach notification. Every employee should know how and who to report a possible breach. So make your employees your defense team against breach. Maybe you perform a mock breach to assess and identify if there are gaps in your policy. Maybe you engage a third party to conduct some audits. So I'm showing you an email that I get from the Office of Civil Rights, and I really encourage you to sign up for this. It's very good information. It keeps you updated, and all you have to do is Google OCR Wall of Shame, and you'll be right there. So I wanted to show you the latest and largest U.S. health data breach in history, and I'm going to try a new little tool so I can kind of zero in here. So it says, Anthem pays OCR $16 million in record HIPAA settlement following largest U.S. health data breach in history. So Anthem discovered cyber attackers had infiltrated their system through spear phishing emails. After at least one employee responded between December 2nd and January 27th of 15, the cyber attackers stole the EPHI of almost 79 million individuals. And the investigation revealed that Anthem failed to conduct an enterprise-wide risk analysis, had insufficient procedures to regularly review information system activity, failed to identify and respond to suspected known security incidents, and failed to implement adequate minimum access controls to prevent the cyber attackers from accessing sensitive EPHI beginning as early as February 2014. So you can see that everything that we've touched on already today are things that they did, not this big company is now paying huge fines for. So don't let that happen in your office. So what does HIPAA say about policies and procedures? Policy and procedures are required by both privacy rule and security rule. So this is not only just for practices who participate in meaningful use or MIPS programs. This is for everybody. And I know it's a real busy screen, but I think that it was important, so I wanted to put it all up there for you. So I won't read the whole thing, but you'll see that the HIPAA privacy rule says a covered entity must train all members. A covered entity must document the training. The HIPAA security rule down here says implement policies and procedures and implement a security awareness and training program. And some of the implementation specifications would be security reminders, protection from malicious software, login monitoring, and password management. Now you'll notice that these are all addressable requirements, but if you remember, addressable doesn't mean that you don't have to do it. If you don't have these in place exactly like they're telling you to put them in place, then you have to have an alternative to them, and you have to document why an alternative to these rules is sufficient. So really, I can't see that could be possible. So your policies and procedures, they're your bedrock to compliance. Anyone who is required to comply with HIPAA needs security policies and procedures as part of full compliance. So I'm pretty sure that would be all of us that are on this call today. Now, I've worked with practices who bought a book of policies and procedures online but never customized it to fit their office policy. If you don't customize them, then you've wasted your money and you're in violation of HIPAA. And the OCR have sent information that said the most common violation found during a HIPAA audits were the lack of or outdated policies. Security risk assessment, it's your guide guide to the needed policies and procedures. Have your employees been provided with formal information on security training? That's required annually. Have policies been communicated to your employees? Are periodic reminders provided? Are your employees required to sign a non-disclosure agreement? One of the HIPAA security rules standard is to write policies and procedures that set out what security behaviors your practice will engage in. Essentially, full compliance with HIPAA requires your practice to write out policies that cover all of the HIPAA security and privacy standards. And so what's the difference between policy and procedure? So a policy defines an organization approach and defines enforcement and consequences for the violations. The procedures is a step-by-step instructions that explain how to implement the policy. So if you left your job tomorrow, and could the person coming in to fill in your role, would they be able to follow the written policy? It's not really much different than writing a treatment plan. You want clinical documentation to prove that you're meeting standard of care. So in the same way, you want security documentation to prove that you're addressing security standards. Policies must be modified to changing needs of your organization, or if the rules change, the changes must be documented. So if you don't have policies in place now, look up the privacy and security rules, as these are the rules with the list of the policies that you're required to have in place. The HIPAA privacy rule covers the confidentiality of PHI in all forms and formats. So, and any policy that was written and not updated since 2013 would be considered non-compliant, because the omnibus rule came out and into effect in 2013, and policies needed to reflect these changes. So these types of changes catch that of an auditor, as will a book of policies that have been purchased and not implemented, or policies that were downloaded off the internet and have some other practice name on them. Yep, believe it or not, I've seen this. So it's not necessary to recreate the wheel. You can purchase the policies and procedures, but what is needed is to customize them, and that will follow what HIPAA said about policies. Policies establish measurable objectives and expectations for the workforce, assign responsibility for decision-making, and define enforcement and consequences for violation. Procedures describe how the organization carries out the approach, setting forth explicit step-by-step instruction that implement the organization's policy. You cannot achieve this unless you customize your policy. So I'm showing you now a graphic of the table of contents of the PBSI Customized Policy and Procedure Manual. This is a 97-page manual that follows the policies and procedures required by HIPAA, the privacy rule, and the security rule. And so these policies are your guide to what is required in the security risk assessment. They go hand in hand. Without policies, you would fail the security risk assessment. The table of contents recaps all the policies and procedures that are covered in the manual. We also provide needed forms. Pictured are a few examples of the logs that we provide with your manual and a list of all the forms that are included. And so auditors are going to ask to review your employee training log. Training is important. It's not a suggestion, it's required. That business associate agreement log, they're going to want to look at that. You're going to have that accessible so that you can upload that when asked for it. Very important, your security incident log need a written security incident procedure, and employees need to be trained on when and how to report a breach. So get a security policy manual that will follow HIPAA requirements. If you're a covered entity or a business associate and you store PHI, then you must perform a yearly security assessment. It's not a checkoff sheet. It's a detailed analysis with specific requirements. It's required by HIPAA. This is not only for those involved in payment programs. An auditor will ask for this document. They are specifically interested in this risk findings page. The most important requirement of the security rule is to complete the security risk assessment. The risk assessment gives us guidelines to fix risks and vulnerability in a security and a day-to-day procedures. In essence, it's a list of questions that helps us to assess where we are vulnerable. For those who have participated in meaningful use and now participate in MIPS, the #1 core objective that you attest to is the completion of the security risk assessment. So if you passed meaningful use, then you attested that you completed your yearly security risk assessment. So when the auditor comes and asks for it, you need to have that. It needs to be dated for that year that you attested to. So our goal is to produce a detailed report to close any compliance gaps. So start by taking an inventory of all your devices where electronic PHI is stored or has potential to be stored, such as your server, backups, laptops, tablets, people bringing things from home, desktops, fax machines, copiers, cell phones, dictaphones, and it goes on. It's always a good idea to have a list of inventories, because what if you had theft or fire? You want that information available to you right away. That should be part of your disaster recovery plan. And so then we examine the people and process that have access to the PHI. So that's when you get out your policy and procedure manual. The security rule will give you guidelines of what policies you need to have in place. You'll probably find that you need to write and address many procedures that most likely are not currently happening at your office. Steps that will assure that your data stays safe and keeps you from PHI breach. We are focused on a goal of creating a culture of compliance, so make that the theme of the office. And then look at your technology. Who's remoting in? What is encrypted or should be? Who's using your wireless access or text messaging? You might need to contact your IT support team to help you with this section. So after you've done all your research and gathered the necessary information, you need to document, train, and implement the policies. So let's find the best plan for you. So there's not a real given format or tool that's required to be used for the security risk assessment, but they will want you to follow the different rules. What is required is that you address every safeguard set in the security rule. So you can always try it yourself, get a downloadable tool. You will need to engage your IT company because there'll be questions that you typically would not know the answer to. Do your research and understand the questions so you give the right answers. You might decide to add some outside expertise to complete or review your security risk assessment. So what I'd like to do is show you an example of the risk assessment that we use here at PBSI. And this is the tool that is recommended by ONC. So we start out with an inventory. So I've given you a sample of an inventory type. Put serial numbers on it, whether or not it has EPHI on it, and if it involves technology or people in processing handling it. And then we'll move on to the screening questions. So it gives you a screening question and then has you answer with, have you addressed this? Have you partially addressed it, or you've not addressed it? So I'm going to click this one. And then we move on to people and processes. So in the people and processes, we'll put our existing controls. So this is asking for, I lost my train of thought. For security officer. So we would write the existing control in here and then go down and say if that control is effective. And then what the exposure is would come from our screening questions and what the likelihood that this threat could happen to us. So very likely, maybe likely, not likely. And then what's the impact that would have if that threat actually did happen? So you would decide if it's high, medium, or low, and that would give us a rating. So this is what that end page was that had all of the risk ratings on it. So they're not looking for you to come in and say, oh, I didn't have any risk at all, because that would look like pretty suspicious, because we all are going to have some things. But what they're trying to do is to get you to realize what you need to do and then handle it. And so for each year, the reason you're doing it yearly is that you're supposed to be addressing what the risks are. So the following year, your answers are better. And so the medium or the high risks will go down in number. So we'll do the same thing under technology. And then it will complete our findings page and show us how many medium and how many high risks that we have. And this is what we'll submit to for audit. So there are benefits of having a professional help you with the security risk assessment and your policy and procedure manual. We do the research, we do the documentation for you. You get a set of fresh eyes to look over how you're securing your data and how your staff is handling the data. You're busy, and the job takes a lot of time. I know that you always don't have the resources to complete it. So reduce your risk and fear of audits and fines and improve your quality of your procedures. So let the professional be the fall guy to help you with employees to follow the rules. Sometimes it's just much easier if it comes from an outsider. So if you've attested to meaningful use, please make sure that you have a risk assessment in place. I've helped many practices through audits. Trust me, you do not want to tell your doctors that you failed the audit, because that means that the money that you've already spent is going to be taken back. So minimize your risk of HIPAA security audits and penalties. You need to create a HIPAA security action log and document what you found lacking upon initial security assessment, show mitigation process of high and medium risks, update your employee forms, and initiate and document employee training programs. Secure all your PHI. That's the single most important item. Once you learn, you must address. Encrypted data is excluded from breach. Laptop encryption, wireless security, firewall rules, monitored antivirus. Security is a part of your culture, and you must be able to approve it. So I want to thank you for your time. I've listed my contact information. Please feel free to reach out to me if you have any questions about what you're doing. I would be happy to help you.
Janet, thank you very much. I encourage anybody who wishes to reach out to Janet directly. She's happy to help, and there's no fee for inquiries, and if we can help with just recommendations, that's what we're here for. Okay, so I'm going to move on and talk about some of the most important things that you want in place, both for security and to be able to document security. So I look at PBSI, though we have hundreds of clients, I look at us as a small business, excuse me, and as a small business, I'm sensitive to cost-effective tools. So one of the things I can say, it's never been PBSI's goal to be, quote, cost-effective as priority one, but I also know that we serve, generally speaking, the range of small medical practices, and as a result, we've worked really hard over time to make sure we use tools and the way we charge for services we provide is very, very cost effective. So I want to just look at quickly the package, and we will be done by 1 o'clock, the package of services that are available that are really important. So it doesn't matter so much that they're available from PBSI. What's important is that you see an example of how some of these things can be done. So the first thing I'm going to do with online monitoring is look at how the basic package of key security is bundled together, and that includes antivirus, patch management, vulnerability scanning, and online monitoring. So a quick demonstration. I'm going to PBSI's website, and I'm looking at the tool that PBSI uses, and many, many of you who are watching and listening use PBSI for this sort of services. We really do pay close attention to things going on at clients. So along the left-hand side of the screen are a list of clients, and I've selected PBSI, so the only devices that show on my screen are devices at PBSI. So we can look at servers or workstations or mobile devices. I'm looking at workstations at PBSI. So what I'm looking at is the dashboard, and we have 45 PCs being monitored on our dashboard. This is the dashboard our technicians are looking at every day from 8 to 5, and where alerts are broadcast and monitored 24/7. Now, we're not paying attention to most alerts at midnight on a Sunday night, but we do have special consideration and alerts for servers down and things that are really critical. So the things that I want to identify here, I'm going to limit the number of PCs that display on this list to the ones that have Ray in the name. So here is my work desktop. Here's my Microsoft Surface. And what happens, rarely does a technician go into an individual device like this to say what's going on Ray's Surface. Instead, what's happening is there's an online monitoring process where alerts of significance come to the top of the list for all clients. And so if a PC at a client has an active virus, boom, it's right at the top, and we're immediately aware before the end user in many, many cases, unfortunately. So what happens is for every monitored device, there's an agent installed, and that device reports into a secure dashboard generally once an hour. We could do it more frequently. And what happens when Ray's PC reports into the dashboard, it reports into a list of a whole bunch of different criteria that we're looking for. So one of the things we're looking for is failed logins. So one of the things that's required is that you pay attention to failed logins and have the ability to document and provide audit logs. Well, that's fine for reporting, but what's really important on a daily basis is to make sure that there are no failed logins. This would be an indicator of an attack. So inside of a firewall that's properly managed, there shouldn't be failed logins, but if there is something inside of your network where another PC has been compromised or possibly your own PC, then you might see failed logins, which would be a reason to strongly suspect, if not prove, that there is malware running on that PC that's made it available to the outside, and people are trying to guess passwords. So just among all the things that are monitored, web bandwidth, if backup's working successfully, patch management. So the three basic things that have to be in place are patch management, vulnerability scanning, and active antivirus. So patch management tells us, and in this case it says there's one missing. Sure enough, Google Drive has an update that's not updated on Ray's PC. So we set patches to update twice a week. So it's not unusual that one would be missing, but if this were an important one and it's overdue, then a dashboard technician who got an alert could say, let's approve that one, and now it's changed to pending status. So this is something that happens automatically. A missing is not a critical, but there are many conditions where one has failed that we get those alerts and we fix. So what that is, the importance of that is that the reason it's important that your patches are up to date is every software vendor out there, Microsoft, Apple, Adobe, issue security patches that are free of charge to products that are installed in the field. And you want, and we make sure for every client that's covered with the service, that you have every PC set to automatically download all of the security patch updates. And so what happens is the patch updating is automated and the online monitoring is provided by PBSI. So when it happens, and those of you who have a technical background will understand that it happens all the time, that a patch that is set to update automatically doesn't update, that somebody gets that alert and they cause it to update and do what's required to make sure that it's because the PC was turned off, or there was a conflicting piece of software, or there was a file open. There are all kinds of reasons why a patch might fail. But the key is unupdated software patches are the #1 gateway that permits malware to do damage on a PC. Because the security patches that were released because somebody uncovered a fact that version XYZ or prior of Microsoft Word or Windows 10 or whatever the software prior to that version, there was a vulnerability that if somebody took a certain approach and made their behavior work a certain way, then they would be under the surface and all of a sudden they'd have root level access to that PC and Katie bar the door. They're inside of the network. So updated security patches are not only really important for security, they are a key requirement of HIPAA. Must have your patches up to date. HIPAA doesn't require that you have it monitored, but I can tell you without monitoring, it's an impossible task. Who of us has the time and energy to go to each PC in our office and sit down and look at the patch status and make sure everything's up to date? This way, it happens automatically online every night. So patch management is one thing. Antivirus is another. So there are nightly scans run, but every hour we know that if there have been any updates to security antivirus, that it's been updated real time. And this is throughout the day. All these different checks that are made here, one of them is to make sure that the antivirus is updated. And I can look and see the history of when antivirus is updated, and you can see that October 25th, there were, 8 or 10 different updates. So this isn't something that would mean that there were 8 or 10 different security flaws that had been found just during the course of that day and updated. So the world of the bad guys is very, very active, and you need to make sure your antivirus is up to date and that it's monitored. So the final thing is vulnerability scan. So a vulnerability scan we set to run every night on every PC or every server that's monitored, and they would show that scan checks for the status of dozens of items and would alert any failures. So alerts would show up instead of green check marks, it would show up as a yellow warning or a red fail, and those would show up at the device level, and those would come to the top of the dashboard, things that are red. So total cost for this package of antivirus, vulnerability scanning, patch management, $6 a month per PC. We have competitors charging $20 and $30 and more dollars per PC per month. And I dare say we pay more attention, we do the job better. So I'm not trying to sell services here. I am, however, well, possibly I am, but most importantly, I'm identifying what is behind the requirement. You need to have this monitoring in place. So another thing that we can see, this is my PC that's set for online backup. So I don't really store anything on my PC that's critical. I do this for demonstration, but you can see that prior to this date, the yellow line, this was, my backup was set that something was causing an error, and so it was only partially updated. I know that it's been updated successfully every night except for this past weekend. There was a power failure, and so my PC was off and backup didn't take place. So this is not very important if it's on an unimportant PC. It can be critical if it's on a PC where you have key data and it's not backed up elsewhere. Okay, so vulnerability scanning, antivirus, patch management. I'm going to do two other quick things. And one is I'm going to identify that there's a separate scan that can run called a data breach risk intelligence scan. And what that does on each PC is it runs a test, as it does on mine every night, and it shows what data was found that might have PHI or PII in it. So it finds social security numbers, dates of birth, and reports on those. So this goes beyond required, but what it does is it finds if a hacker got into your network or onto your PC, what could a hacker access? So if you have a list of social security numbers on a billing person's PC, they might not recall that it's there, but this scan will find it, and this is the best ironclad proof you could ever give to an auditor that you're not paying attention at a broad level. You're paying attention every day to every single piece of potentially exposed information. So anything would be found if it's unencrypted. Okay, final thing that I'm going to mention is a training program which we've become really proficient in administering. This is a training program that does lots more than just HIPAA training, but I'm going to focus on HIPAA training and I'll do it really quickly. The idea is you can sign up for one-time HIPAA training and execute this in a track, and I'll show you what that does, or you can sign up for ongoing training, which is a recommended thing. We use KnowBe4 training at PBSI for all of our employees, and we have a bunch of clients where we do the same thing. Again, it's cost effective and it is effective. So in general, the KnowBe4 program includes HIPAA and others, so it includes the ability to send phishing emails, security training tip emails, training videos, and that's what I'm going to focus on here real briefly. The idea is we're testing employees with emails to try and trick them into clicks, and then we're providing education, and we're also setting up training activities. So I'm going to go to our KnowBe4 dashboard, and I'm going to skip the setup of an email and how a client or employee gets it, but the bottom line is this. For each, if your office were to set up, sign up for this one time, we would set up all of your employees and their email addresses and set up a campaign that we'd talk about where they'd get a certain email that says you have to, we've entered into this training program. We want to have you watch this video. We're going to send you a couple of other emails for training, and we're going to record. So what happens is we're going to include in this email a link to a course. And there are lots of courses, hundreds of options for training, but in this case, I'm going to look just for those related to HIPAA, and I'm going to give you just a short example of what this would look like. Sorry, let me do this again. Well, I really need to spell better than that. I want to just show you what this does. The beautiful thing about this is it's very fast, it's very efficient, it covers all the basics, and yes, for most employees,
Healthcare compliance module for end users. This material is supplementary.
I can go piece by piece. You can see there's a menu of activities. It's short, and at the end, so we're going to, and so forth. You can hear that on my speaker. And so one would go through this entire course and end up with a quiz. So at the end, welcome to this, then the next question, answer this question, answer the next question. And so the typical end user takes 20 to 22 minutes to go through this entire course. At the end of the course, they have learned in a easy to follow fashion everything really required that somebody needs to be trained about. And, excuse me, this is auto documented so that we get, during the course of training, we know that 82% of the users have completed so far this course and how many per day. We know which employees have completed or not completed the training. We know at any point in time we can download, so this is great documentation. We have each staff person's name, when they completed it, what the status was, and just because an employee doesn't complete it, if we've done due diligence to put it in front of them and track it and make sure they did, if you have a doctor who simply won't take the course, well, okay, at least you've documented the fact that you presented the material and you had one employee who wouldn't comply, and then each person gets a certificate. So the thing I want to point out there is there's cost-effective and very available, excellent HIPAA training that self-documents. So we're about finished with content. I just want to summarize that the Know Before HIPAA training can be done one time or can be done ongoing. We can assist with policies and procedure, and Janet has done a fantastic job taking templates from the internet, if you will, from credible places, and tuning to fit what would be really the policies and procedures that would be in effect for a typical small practice. So much closer than what you're going to get from the internet. We spent just a ton of time over years making this better. So hopefully you already have good policies and procedures. You don't need some from us, but we include logs and forms, and it's available. We can help with risk assessments. We can help find exposed passwords, and we can set up online monitoring. Okay, that was quick, but I want to thank you for your attendance. We're finished with content. I want to open up for questions, but you are welcome to log off.